I'm Dr. David Martin, and I'd like to welcome you to Middle Tennessee Plastic Surgery. For thousands of years, we've appreciated the beauty and intricacy of the ideal human form, and for just as long, physicians have sought to restore and enhance that natural elegance of human appearance and function. The specialty of plastic surgery derives its name not from the use of plastic, but from the Greek word plastikos, which means to mold or shape. Modern plastic surgery owes much of its origin to the necessities of the early 1900s, when soldiers from the First World War suffered devastating injuries on the battlefield. With compassion and innovation, surgeons began to develop techniques for reconstruction that remain spectacular even by today's standards. Patients with tumors, birth malformations, and other serious disfigurements became the challenge of talented and empathetic surgeons whose efforts continue today. These methods reach their highest refinement when applied to the performance of cosmetic plastic surgery, whose purpose is to enhance or restore a person's physical appearance. If you're considering evaluation by a plastic surgeon, how can you assure that you're making a good decision? Is surgery right for you, and are you likely to be happy with the results? While no surgery and no surgeon is perfect, I recommend focusing on three important factors: the right doctor, the right procedure, and having your surgery performed at the right time. Start by finding the right plastic surgeon for you. First, do your homework. I recommend you seek consultation with a surgeon certified by the American Board of Plastic Surgery, the only accredited medical board devoted entirely to the specialty of plastic surgery. Doctors who are certified by this board must have excellent, broad training as a medical doctor, but also full training as a plastic and reconstructive surgeon. I was fortunate enough to attend the Johns Hopkins University School of Medicine in Baltimore, one of the world's premier and most prestigious medical schools. My residency training culminated at Washington University in St. Louis, one of the largest and most diverse plastic surgery training programs in the country. Make sure your candidate has received excellent and broad training across the spectrum of the specialty and has expertise in performing surgeries in all areas of reconstruction, as these experiences provide the best foundation for offering patients advice and proper treatment. Well-trained surgeons have acquired the technical experience to perform surgery with precision and familiarity under easy circumstances and even under difficult ones. Be wary of physicians or others who advertise that they perform plastic surgery when in fact they are not fully trained plastic surgeons. Some have not even been trained in a surgical residency at all, or have received only an astonishingly short training in some individual procedure, such as you might get over a weekend. If you're considering letting a doctor operate on you, take the time to make sure you understand how he or she was trained and the type of credentials he or she possesses. Make sure your doctor has membership in professional organizations such as the American Society of Plastic Surgeons, and that they have a demonstrated commitment to serving their local community. Investigate the longevity of their medical practice to ensure that they'll be there for you as well after surgery as they seem to be before. Make certain that they have an established reputation in that community. You can also verify that your doctor has active hospital privileges at their community hospital, which is another indication that they have been properly trained and comply with continuing medical education and other requirements. What about the procedure itself? How do you know if the procedure recommended is the right one for you? Your plastic surgeon should take the time to listen carefully to your concerns and clearly explain the proposed procedure. What are the pros and cons? And how long will it take to recover? Are important questions to ask. Make sure your doctor explains the potential risks and complications of the procedure and the costs involved. Any doctor that doesn't seem to have time to answer your questions before surgery may not be very likely to be helpful after surgery has been performed. Be watchful for unrealistic promises for no-scar procedures, or those that suggest there is no downtime or that offer results that seem a bit too perfect. If the newest technique that no other doctor seems to be able to offer seems too good to be true, you may end up having more problems than you had bargained for. Finally, what do we mean by making sure you undergo surgery at the right time? Undergoing any surgery, even minor ones, can be stressful. It can be inconvenient, it can slow down your usual pace of life, and temporarily keep you from participating in all the other activities that you enjoy and need to do. If surgery isn't urgent, make sure you have the other aspects of your life in good alignment and you feel positive and optimistic about proceeding. At Middle Tennessee Plastic Surgery, we try very hard to listen carefully, speak truthfully, and make your experience as pleasant and rewarding as possible. We have attractive private offices in the Tower Building next to Williamson Medical Center in Franklin and in the Gateway Plaza Building in Murfreesboro. We welcome the opportunity to meet you and discuss your hopes and thoughts about plastic surgery, and we thank you for taking the time to watch our video.